In our post-COVID world, we're more aware than ever that air is critically important to our health. Our guests are the top experts in understanding everything from smoggy air we breathe outside to what we inhale when we're in the office.
There's something in the air that we are breathing in, whether it is the COVID virus or whether it is wildfire smoke particles or gases and particles that are emitted by gas stoves and cooking. And these have really can have really strong impacts on our health and can really have adverse effects on our health that I think we didn't appreciate as much until the pandemic came around and we realized that it was an airborne virus.
Joining us is renowned environmental engineer Linsey Marr and Peter Templeton, who's the president and CEO of the U.S. Green Building Council.
First, I'm a huge fan of Dr. Marr's work and really grateful for everything she has contributed to the science that we draw from and ensuring that our buildings are delivering on those expectations of better indoor air quality. So this is something that's actually been exciting. Over the course of the 30 years of evolution, there is a lot that has come into play. When we started, there were a lot of prescriptive measures that we have encouraged, to higher rates of filtration and to ensure that we're doing the right things on the design and construction side and certainly in operations of our buildings.
This is Conversations on Healthcare.
Well, welcome, Professor Marr, to Conversations on Healthcare.
Thank you so much for having me.
And congratulations on the MacArthur Foundation naming you as one of the recipients of its Genius Grant just a few weeks ago. You're an expert on airborne transmission of infectious bioaerosols. During COVID, you led some groundbreaking research that corrected our understanding, or maybe our misunderstanding, of how the virus was spreading. I'm wondering if you could take our listeners through your discovery.
Yeah, a lot of that was based on our research that had been going on for a decade before that on flu transmission. And we thought that a lot of respiratory viruses transmitted in the same way. Even though we know the viruses are different from each other, maybe they're different in size and have different properties, they're carried in respiratory droplets and tiny particles that are emitted when we breathe, talk, cough, and sing, whether we are, and these droplets come out whether we are infected or not. And really, it's the size of those droplets and the ability of the virus to survive in those droplets that dictates how the virus is going to transmit, how it's going to get from one person to another. And so what we found is that the flu viruses, and then since it was later shown that SARS-CoV-2, the virus that causes COVID-19, is released in tiny respiratory particles that are small enough that they can float around in the air for many hours. And that you can breathe these in and become infected, both when you're close to a person, as if you are close to a cigarette smoker and breathing in a lot of their exhaled cigarette smoke, and also if you're farther away, because they can be carried great distances and they can build up over time in a poorly ventilated room like cigarette smoke does. And so that can lead to exposure and infection too.
We know the history of science and medicine is full of stories of very expert people like yourself who are brave and bucked conventional thinking. We're really curious on a personal level, where did you find the fortitude to proceed with this? Were you always convinced that the COVID virus would turn out to be airborne in this way that really changed the way we modified our public health protocols?
From what I was seeing coming out of China in December and January, I was pretty sure that the virus was transmitted through the airborne route. It was because the original SARS from 2004 was shown with pretty good evidence to be airborne. And then we saw how rapidly it was spreading in China. And then we saw photos of healthcare workers where they're wearing full respiratory protection. And, people just don't wear that just for fun. It's expensive, it's onerous, it's burdensome. And so I figured they were wearing it for good reason. And this was also based, of course, on what I knew mechanistically, kind of fundamental science about how viruses are released from people's noses and mouths and how they move around in the air. And so based on that, and then really what finally convinced me was seeing the Skagit Valley Corral outbreak in the US in early March of 2020, where I think almost 90% of the attendees at that choir practice got infected, even though they knew the virus was present. They avoided shaking hands, they maintained their distance, but they were together vocalizing for a long period of time in a poorly ventilated environment. And so for me, that was kind of like the final thing. Although even right before that, I had posted on Twitter, let's talk about airborne transmission of SARS-CoV-2, because we needed to clear up a lot of misunderstandings and incorrect assumptions, and I wanted to present a more accurate view of how the virus is transmitted. And the fortitude that really came from, I was pretty sure I was right because my knowledge was based on physics, and you cannot violate the rules of physics.
It's a good lesson for everybody.
I'm wondering, some people think the COVID's in our rearview mirror, but it's not. And so many people are still looking for some guidance. When I go to these large events, should I be wearing a KN95 mask, or how should I walk through this lifetime, given that COVID's still all around us? It's mutating all the time. I want to both be safe and I want to have a life. What's your secret sauce, if you will, that might give people some guidance? No assurances, but what's the best strategy in your mind?
Well, first of all, it comes down to your own personal risk tolerance, which is going to be affected by your own health conditions. If you're immunocompromised or you live with people who are, then you're going to take extra precautions. How disruptive is it going to be to your work and life schedule if you're sick for a few days? If it's not that disruptive, then you can afford to take a few more risks. But if you have some critical event coming up, maybe in the week ahead of time, you want to be extra careful. And so what I do is I think about these higher risk environments. And in those situations, I wear my N95 and I really pay attention to what's going on around me. And those are places where it's crowded, where if I hear people coughing, of course, if I'm in the airplane while we're still on the ground, when the ventilation system may not be running. I've heard a lot of people who have been getting sick recently, COVID and other respiratory diseases when traveling. That's common. We're in these big crowded environments, and that's where these viruses are floating around the air. It's very easy to if they happen to be there, you're going to be exposed. And, in some cases, your immune system can fight it off. In some cases, it can't.
But it's a great tool. The mask is a great tool. And you've talked about air, the turning of air in a room. When you were talking about on the tarmac, the plane is still not engaged. It's not turning the air at 6 or 10 times the cycle time. What about for hospital healthcare facilities? What's your recommendation for the amount of times that air should turn? Or for most people who are listening in their own home, what can they do?
Well, hospitals have to follow existing regulations and guidelines, which are that they have to have at least 6 air changes per hour. So the air in a room changes over 6 times, is replaced with cleaner outdoor air, filtered air in patient rooms. And then I believe in surgical theaters and other critical areas that it has to be 12 air changes per hour, which means at least every 5 minutes the air is changing out. Now, the hospitals really have excellent ventilation, because if we think about our homes and other places, we typically see more like half an air change per hour, meaning it takes 2 hours for that air to change over, or maybe up to 3 air changes per hour at best. The CDC is now recommending 5 air changes per hour in every public place, and that could be your home too if someone's infected and you want to increase ventilation, reduce the risk of transmission to family members. So I think the critical places to focus on this, though, are things like schools, where lots of kids together for long periods of the day, and the ventilation there is usually well below the recommended value of 5 air changes per hour.
Professor Marr, you wrote in the New York Times recently about COVID and the link to wildfire smoke and gas stoves and what this tells us about air quality. Explain this for us. We may not see the connection the way you do.
Yeah, I think what it's that there's something in the air that we are breathing in, whether it is the COVID virus or whether it is wildfire smoke particles or gases and particles that are emitted by gas stoves and cooking. And these have really can have really strong impacts on our health and can really have adverse effects on our health that I think we didn't appreciate as much until the pandemic came around and we realized that it was an airborne virus. I'll make an analogy to our drinking water. And if everybody knows that they shouldn't drink dirty water, and if somebody hands you a glass of dirty water, you're not going to drink that. In the air, the same really should be true, that we should try to avoid breathing dirty air. It is bad for our health. It causes short-term effects like coughing and wheezing, exacerbates asthma, and it also causes long-term effects. It contributes to cardiovascular disease. Air pollution is one of the leading causes of death, premature death worldwide. It's responsible for 7 to 8 million premature deaths, as estimated by the World Health Organization.
Scientists and researchers like yourself are running into lots of controversy, so we must ask you about the gas stove controversy and how opponents have fanned the political flames, if you will, about it. So the House of Representatives passed a bill to block any possible ban on gas stoves, even as regulators look into the potential health hazards of gas stove emissions. So let me ask you to explain these health hazards and how severe they are.
Yeah, well, gas stoves burn methane, and when you have any high temperature combustion, you can form a pollutant called nitrogen oxides. And those have nitrogen dioxide is one of the EPA's 6 criteria pollutants, meaning that we have outdoor regulations for it because it causes respiratory irritation, things like coughing and wheezing and exacerbation of asthma. And so you're emitting that into your home, and it can cause similar effects, of course, in your home. As far as the level of those effects, it's not clear. There have been some studies. I don't know that we have kind of the smoking gun type of evidence yet to say that, in all situations, all gas stoves are terrible. Certainly, if you have good exhaust, really strong exhaust ventilation, that will help mitigate any risk. But the laws to kind of preemptively bans on it, it seems silly. It's like, would we have a law to ban on cigarettes? I don't know, just seems a little bit premature to enact those types of rules too.
Professor, we'll be talking next on our program with the president and CEO of the U.S. Green Building Council. You've noted that we need major improvements in ventilation and filtration in buildings, as you've just been describing. If you were in that interview, what would you want to ask the Green Building Council, and do you think they're moving fast enough?
I would ask them, do the green building guidelines have, do they give sufficient weight to clean indoor air? Because they certainly consider energy consumption and thermal comfort. And I think we need to make sure that the clean indoor air and healthy indoor air is being properly weighted, and to really think about innovative ways to do that where we don't necessarily have to make our buildings so tight that the air becomes stale and unhealthy in them.
Wondering which communities you look to for leading the way to improving air quality, and maybe if you know this, what's the secret of their success?
Wow, that's a tough question. I would say that EPA has a long history of outdoor air quality regulations and guidelines that have really helped clean up our outdoor air. So I think if we look over the past 50 years, in the 1970s, air pollution in the U.S. was really terrible in some cities. And we've come a long way due to that, also with leadership by the California Air Resources Board. Beyond that, I think the American Lung Association looks a lot at this. And various asthma organizations, I think, are concerned about it. So I think that's where we can look to for leadership on this, because there is a good history, a good record where we have really cleaned up outdoor air.
Yeah, let me ask one more question. About how many particles really one needs to or might get one infected. And I know that probably depends on the health of the individual. But I was also thinking about what we've learned from wastewater, that we can tell how much COVID might be in the community. We don't have anything analogous that one could wear or for any environment that you're in that might tell me the air quality around COVID as I walk through a room. Anything that's out there that looks promising, that's exciting, that might help us as we're trying to figure out how to navigate spaces.
Yeah, the wastewater data are really helpful to see what's going on in a community. If you want to know what's going on in a certain building where you are, that's we still have some more technological leaps to make. So where we get to the point where you can carry some device into a building and it can tell you, oh, there's lots of coronavirus in the air, and here you should put on a mask or go minimize the amount of time spent here. I think there's discussions about trying to monitor this in HVAC systems or looking at dust, but we still, and there are some promising technologies that have been developed to do this. They're still cost prohibitive, I think, for an individual at this point, but I think, in another many years, we will get to the point where we might have something like the handheld carbon dioxide sensor that people have been carrying around to help assess ventilation in buildings.
Well, Professor Linsey Marr, we want to thank you for joining us. Your work in helping us understand how COVID is spread likely is leading to better air quality in our buildings against a multiple set of factors and not just COVID. Thank you so much for joining us today on Conversations on Healthcare. We really appreciate it.
Yeah.
Thank you very much for having me.
Yeah, absolutely. We continue to follow your work, and thank you and the group of folks you work with for all the work that you're doing in this area.
Let's hope for cleaner air.
We're continuing our discussion about environmental quality with Peter Templeton, who's the president and CEO of U.S. Green Building Council. Peter, welcome to Conversations on Healthcare.
Thank you. Delighted to be here.
The council was founded 30 years ago and is best known for its LEED green building rating system. I wonder if you could share with us an overview of the council and also of LEED.
Sure. Well, the U.S. Green Building Council is really representing individuals and organizations across the entire building industry that have come together to advance the topics of environmental health and well-being within the context of the built environment. So we work on ways to make sure that we're protecting the well-being of building occupants, our communities, our planet, and our climate within the opportunities that are presented through building development, design, operations, and construction.
Peter, with any kind of rating system, certainly something as high profile as I think LEED is, there's always questions about its effectiveness. There's always skeptics. People want to know, how do we know that this is succeeding at really creating cleaner, energy efficient buildings? What's your answer to those questions?
Sure. So, and that is exactly why we've created the LEED rating system, is to ensure that there is some sense of certainty in terms of the outcomes that buildings are going to be able to deliver for building occupants and, of course, for their owners and for our communities. And so really, we've created a standard that is built on tested, proven strategies and trying to make sure that there's scientific rigor and technical rigor behind that and able to deliver on those expectations. We base our standards on input that we receive from stakeholders across the entire industry through our standard development process, and make sure that we're tying back to the best research that's available and the best industry information about the ability and accessibility of those strategies to be deployed in different sectors of the industry. So over the course of the year, we've been able to reach over 110,000 certified projects, and across those projects, we see that these outcomes are real and tangible through studies that have been referenced in every corner of the world about how it is that we deliver spaces that are better for our occupants and our communities.
Peter, just remind our audience there are different levels for LEED. Is that correct? And maybe just sort of walk through that hierarchy for us.
Gladly. So the LEED rating system is structured as a rating system itself with outcomes that come from certified all the way to platinum, certified silver, gold, platinum certification at different tiers of building performance. And so we're trying to encourage every building to embrace the opportunities that it can to optimize its performance. And so encouraging higher levels of performance in all circumstances.
And Peter, we also interviewed Professor Linsey Marr, who's a pioneer in understanding the role of COVID's airborne transmission, something we all got a crash course in over these last years. We told her we'd be talking with you as well. And I think her question is, so how do you measure for clean and healthy indoor air when we now have this recent experience of COVID? We all know the airport stories, the getting on the plane stories, the exam room issues. How is that considered in LEAD, that sort of health dimension of it?
Yes. Well, first, I'm a huge fan of Dr. Marr's work and really grateful for everything she has contributed to the science that we draw from and ensuring that our buildings are delivering on those expectations of better indoor air quality. So this is something that's actually been exciting. Over the course of the 30 years of evolution, there is a lot that has come into play. When we started, there were a lot of prescriptive measures that we have encouraged, to higher rates of filtration and to ensure that we're doing the right things on the design and construction side and certainly in operations of our buildings. But in 2023, we have accessibility to building sensors and monitors that help us ensure that that ongoing performance of the indoor environments that we're creating can continue to be maintained at those highest levels. So it's exciting because of the science that we have, that we understand more what the impacts are and what we need to be looking at in terms of CO2 levels and particulate levels that are in our level and what that actually translates to in terms of filtration levels and air exchange rates. So really excited that the continuing dialogue has advanced both in terms of strategies and technologies that can support that level of performance.
Peter, one of the incredible things that happened in the pandemic was the opportunity for people to telecommute to work. And I know in our own experience, my God, we had hundreds of people all across the country who are working from home now, which is a great opportunity for them. But it also caused an enormous impact on office space, right? And there's been this real movement to convert from office to residential conversion. I'm wondering how you all are playing a role in terms of policies and best practices with climate change in mind.
Sure. So first, I should say that we've always been strong proponents of adaptive reuse. And so as the market has evolved, we want to make sure that we're continuing to leverage the building assets that exist that have the minimum impact on our environment and our communities if we're able to repurpose them. And so the conversation now, as you've mentioned, has really focused on how offices are converted into residences and lodging solutions, which is also an opportunity for us to address issues around housing access and affordability in many cities and communities across the world. So both on a policy level and a practical level, we're trying to support the industry's efforts to ensure that they're able to undertake these types of transitions. It is not straightforward as it may seem to folks that aren't in the industry. There are challenges certainly on permitting and the ways that cities approach these types of topics, and also the buildings themselves that may not convert as readily to different use types. But we're trying to prepare guidance. We've just released some guidance in September of this year to help the community understand not only how they can undertake some of these conversions, but how they can do so in ways that are going to achieve green building leadership levels of performance.
Peter, I wonder, maybe expanding on the locus of these efforts a little bit. We've talked on our program about why the healthcare sector needs to do so much more on the sustainability front. Certainly one thinks of big hospitals when we talk about that, but healthcare happens in so many places around the country. What are some of the best practices that you can share about the healthcare sector and what it can do on sustainability and quality of air?
Sure. Well, and I'd also just like to add that while the industry as a whole needs to make progress, as every industry does in this context, there has been a lot of great leadership examples to point to across the healthcare sector. I'm really excited to have worked with so many healthcare facilities around the world, now over 3,800 of them that have gone through LEAD process, and excited to use those as examples that we can point to. But there are special challenges in the healthcare environments, particularly when you're talking about hospitals and primary care facilities that require 24/7 operations and redundancy and higher levels of air exchange and things of that sort just to maintain their normal operations, where there are increased energy loads and other vulnerabilities. We want to make sure that everyone is mindful of the trade-offs and the opportunities that are presented within that. We ourselves have created LEAD for Healthcare guidance and work closely with others in this sector to make sure that those practices are understood and that they're attainable for many of those facilities as possible within the industry. But really excited to see that those showcase examples of early leaders in this space are being embraced so widely across the sector.
I appreciate those comments, and I think there has been a lot of leadership at the big health system level, but I think trying to make it tangible and real for the people at the level of the practice, and thanks for mentioning primary care. Certainly when we think about COVID or even tuberculosis, even measles puts terror in our heart when we think about somebody walking in with measles. You don't have time to prepare for somebody with an infection like that. You have to be ready with the air exchanges. And I just wonder, does LEAD sort of lay out a roadmap for the people who aren't going to rebuild their whole enterprise, but what they can do to have the safest environment possible? How do you work at that level, kind of that first or second rung in the healthcare system, which is most likely to come in contact with areas of concern?
And appreciate the focus and the opportunity to address that topic, because it is critically important. We understand that not everyone has the opportunity to build a new facility from the ground up, or even to do a major renovation of their facilities, and we want them to take actions within the scope of influence that they have. And so first and foremost, we're of course looking at higher levels of filtration as a first step to make sure that we're removing contaminants and CO2 levels that are not sustainable by air exchange rates and things of that sort. We do provide guidance and manuals that help address that. And even if folks are not on the continuum towards the leadership certification level, there are steps that they can take that help them improve their performance over time. And we want to make sure that those are positioned as immediate steps that they can take to improve those environments.
I wonder if there's any activity in your organization going just to the individual who doesn't control the organization, doesn't control the facilities of the organization they're working for, but they're so engaged in wanting to make sure that we have a better environment and better climate. What's the pathway for individuals to play in terms of trying to improve on our climate?
So, and that's actually one of the beautiful things about the built environment is it's so actionable. It's so real for all of us. We all live, whether or not we own our homes, we all live in a home, and we have an opportunity to improve that environment around us. Similarly, within our offices and other spaces that we occupy for learning and healthcare, et cetera, we want to make sure that we're doing right by those opportunities. So there are a lot of steps that we address in talking of the context of homeowners, specifically green home guides and other guides that we provide to help ensure that folks are able to take steps that were within their reach. And whether or not that's, within the context of a home renovation, or it's in the context of them deciding, which air filter should I buy for my furnace, or how is it that I approach my landlord about some of the things that we would like to see. It helps provide, some clarity on what are the steps that are going to be most impactful. When it talks about climate change, of course, all of us, have opportunities to reduce our impact in our daily activities, and we want to encourage everyone to embrace those opportunities. And that is, every decision that we're making in terms of purchasing, in terms of transportation, and in terms of lifestyle that we can take to make sure that we're minimizing our impact and in every instance.
Peter, let me go from the micro to the macro, because countries are engaged in conversations about how the planet can be better and what their stewardship will be. I'm wondering if you can think about the EU, US, China, who are large polluters or have a large stake in making sure the climate can be improved. Are they meeting their climate goals? And if not, what else can they do to ensure that we're on the pathway to a more healthy planet?
Yes, it's an extremely timely question. So we're in the year of the UN's global stocktake, preparing for the climate meetings in Dubai later this fall. But we know that from those reports that have been produced recently that we are not tracking on target to meet our global climate goals in terms of emissions reductions, and that there is more work for us to do. We're happy to see that the pace of increase has reduced, but we have certainly not lowered emissions levels to the levels that we need to see. So it does start with commitments, and it is great here in the US, where we've seen the Inflation Reduction Act and other initiatives of the current administration are providing support to take action specifically on emissions reductions across all sectors, but very significantly among them in the built environment. And similarly, we're seeing initiatives with the Green New Deal in Europe, and of course, China's national policies and their commitments, where they are setting clear targets. it's up to all of us who are, involved in different sectors of industry to help ensure that we achieve those targets over time. And as I said, that comes down to decisions we make about building materials. It comes down to decisions in purchasing and supply chain as much as it does around the operational side. So we want to make sure that we're leveraging every opportunity we can to help support achievement of those outcomes.
Well, Peter, if I can maybe get one more question. We went from the micro level of the person, the sector, the building, to the macro at the world level. I wonder, would you like to give a shout out? Are there any communities around the country where you've seen sort of that community-wide embrace through building codes, through community action groups, through coalitions with developers and builders, that you think there's really been a model of kind of a cooperative, collaborative approach to getting to better air quality in our buildings?
It's actually quite encouraging that we're seeing this activity in communities, not just here in the U.S., but around the world, that are embracing the opportunity. And we know that so much of the action that's required to address these challenges is going to be at the local level. So we're excited to see that there is, increased adoption of building codes and performance standards for buildings to ensure even the baseline of building performance is improving over time. And we see that, being adopted here in Washington, D.C., in New York City, in Boston, but also in other communities across the country as a model for encouraging all buildings to step up to improve their performance and deliver on these expectations. And then similarly, the adoption of LEED standards as incentives, both for the public sector themselves, but also for private sector communities, is also very exciting. And so we have a program on LEED for cities and communities where we have over 100 cities and communities across the country that have taken up this challenge of reducing their impacts and ensuring that they themselves and the citizens that they represent are on a pathway towards achieving these climate goals.
Oh, that's so great. Peter, thank you for joining us and for the leadership you're providing and the council is. Also, thanks to our earlier guest, Professor Marr, and thanks to our audience. Be sure to go online to chcradio.com to sign up for our emails. You can also share your thoughts and comments about this program. Peter, thank you for taking the time to talk with us today.
Thank you again.
This copyrighted program is produced by Conversations on Healthcare and cannot be reproduced or retransmitted in whole or in part without the express written consent from Community Health Center, Inc. The views expressed by guests are their own, and they do not necessarily reflect the opinion of Conversations on Healthcare or its affiliated entities.